our focus today is on alopecia, which is, in simple language, we describe it as a patchy baldness. And this is, of course, a condition that affects men, women, and children of all ages. And some of the most common forms are traction alopecia, which results from pulling hairstyles, especially in black afro texture hair, and the typically receding hairline is also one of the more common ones in males. Now, in this week's Monday Health segment, we speak to Professor Ncoza Dlova, who's head of the Dermatology Department at the University of KwaZulu Natal, and she joins us now virtually to talk about alopecia, what it is, and whether there are early signs of this underlying condition that we could look out for. Professor Dlova, thanks so much for your time. Welcome to Morning Live.
Morning, Sakina, and morning to your listeners as well.
So I just gave a very rudimentary type of explanation of what alopecia may be, but perhaps from your perspective, a bit more detail on what this condition actually is?
Yeah, thanks. That was not bad, actually, Sakina. Yeah, so alopecia really means hair loss. And it's almost like saying someone has got headache. But there are numerous causes of hair loss that we encounter. Some of these causes are common in depending on the age in children or adults or males or females, or also more common in certain ethnic groups or certain racial groups. So can be quite specific, and there's a number of causes for all of these. For alopecia, for example, they can be genetic. It could be due to use of certain drugs. Can also be due to connective tissue disorders like lupus, dermatomyositis. Can also be due to alopecia areata, as well as endocrine disorders like thyroid disorders, especially conditions like telogen effluvium. So there's a whole lot of cause of alopecia. And of course, it's a broad topic, and these conditions are common in certain age groups, certain ethnicities, and certain gender predilections.
Professor Dlova, if we could just break that down in terms of the most common types and, amongst which groups they may be more amplified.
For sure. So if we look, for example, at Africans, the most common type of alopecia that we see is traction alopecia, which we sometimes call injibaba. And unfortunately, this condition is self-induced, meaning that it is acquired. It is due to incorrect hairstyling or grooming ways of looking after hair, and one of them being pulling. And we also see it in other groups. For example, if they have a lot of hairstyles where they pull their hair in ponytails, you can also see it in Caucasian patients, Asian patients, or the Sikh group of cultural religious group where they wear those tight turbans. So that can also cause traction alopecia. Now, if you look at men, the most common type of alopecia that we see amongst men is androgenetic alopecia. And we classify that into female pattern or male pattern. The pathogenesis is the same, it's genetic, and we tend to see this type, call it imbandla in KwaZulu, is common again in Caucasian patients and also common more in Asian patients and men. When it comes to children, then there's another group of alopecia that we see. And what we see there actually on the picture is that could be alopecia areata. But we see also in children fungal infections, for example, tinea capitis or mbandam or changuba. And that's alopecia areata on the picture there. And we also see traction alopecia as well as conditions like lichen planopilaris, which are not so common in young children. So that would be the group of most, I'd say the top 3 or top 4 common conditions in each group. And then there's another group called telogen effluvium, where you just get thinning and falling of the hair. And this is usually aggravated by stress, pregnancy, sometimes certain medication that we use for patients, as well as infections and endocrine disorders like thyroid disease. And then there's a group of connective tissue diseases like lupus or dermatomyositis that can also cause hair loss. So that would be a broad classification. And we look at these, whether they're scarring or non-scarring, meaning that if you treat the patient early, the condition will resolve. But other conditions, they are scarring, meaning that they cause irreversible and permanent hair loss. And these are the conditions actually that we have to diagnose early, go in early, treat aggressively to prevent further hair loss.
And then I was going to come to that question next, Professor Dlova, because this is, of course, very debilitating for people when they start losing their hair. So the question is whether alopecia is a permanent condition or is it something that can be cured? And if so, what are some of the interventions?
Yeah, good question, Sakina. So again, depending on the condition that one sees, for example, that the one you've got in a picture there, which is alopecia areata, it's very common in children and sometimes in adults, and it comes as a patch or it can involve the whole scalp. If you hit this early, you may be able to abort it, but sometimes even if you treat it early, it continues because it's thought to be an autoimmune condition. The one you have in your picture there is a condition called, looks like CCCA or central centrifugal cicatricial alopecia, a condition that's very common in women of African descent and it's thought to be genetic based on the study that we conducted. But of course, it is made worse by using chemical products, relaxing and pulling the hair using wigs and hair extensions. What we've got in the picture now is a condition called traction alopecia, very common again amongst African patients. And what's scary, in fact, what worries me about this condition you've got on the slide there is that we're seeing this at a very young age, children as young as like 10 years, 9 years old, whereas in the past we used to see this in middle-aged women. Why? Because we are using hair extensions, we're braiding our children, we're pulling the hair, and therefore they're losing their hair at a much earlier age than before. And yet this is actually a preventable condition. So there's nothing wrong with braiding the hair, but you have to make sure that there's no pimples, there's no headache, it's not painful, and that way you can still braid your children without causing any harm.
Whoa.
There's various forms of treatment, as I mentioned. There's topical treatment. Again, it's a broad topic. You have to understand the age of the patient, how extensive is the disease, what is the diagnosis. Many patients, they come and they've been treated with so many things, but the diagnosis is not there. So we always almost have to make the diagnosis first, and then you've got an approach to the patient, whether you use topical treatment, you use tablets, you use things like platelet-rich plasma, or biologic, and a whole lot of range of medications that are available.
And that's a very interesting point there, Professor Dlova, because for most people, when this happens, firstly, they would shy away, find a way of perhaps hiding in one way or another the condition. But then more readily, I would imagine, try to find these topical treatments, as you pointed out, the ointments, whatever medication may be out there being advertised with claims of curing alopecia. And there are quite a few on the market. But, when you talk about getting a diagnosis first, this is where people generally don't look at. And who do they go to? If your hair starts falling out, who should you consult?
Yeah, thanks, Sakina. That's an important question because many patients, they will come and see us and you find that they've been to so many doctors, so many therapists, and the diagnosis is not made. So the answer to your question is they should see a dermatologist. Dermatologists are trained to treat hair conditions. And of course, if dermatologists are not sure or get stuck, they always refer to hair specialists. So within dermatology, there are individuals who specialize in hair, and they can then refer to those colleagues if they're not sure. But you must have a diagnosis. If you see anybody, they must give you a diagnosis. And if your hair is not getting better, you've got to see a dermatologist or hair specialist, because if you leave it for longer, you're going to lose a lot of hair. And we always say strike early, strike aggressively, and strike appropriately. And that's what you say, so that you can prevent further hair loss. Because once you start late, you've lost the boat and the patient will have scarring and permanent hair loss, and there's nothing you can do. And I want to also emphasize that when treating hair, it's important that in addition to the medical treatment itself, you have to look after your hair, condition your hair, or shampoo your hair. There's a study that we performed recently, and we showed that if, particularly for African patients who tend not to wash their hair frequently because they have the sophisticated hairstyles, the recommendation is that you should wash your hair at least once every 7 days, and you must use a conditioner. So it's a shampoo, conditioner, and moisturize, and you can moisturize your hair maybe twice or 3 times a week. And those, what they call as safe hairstyles or protective hairstyles, actually, they're not protective at all, because when people have the protective hairstyles, they don't wash their hair, there's accumulation of dandruff, and they get inflammation and seborrheic dermatitis, which is a type of eczema. So it's important that whilst you're treating your hair, you also look after your hair. And it's almost like diabetes. When you have diabetes, you have medical treatment and you've got diet that you have to follow. So there's a special diet that you have to follow with when maintaining your hair as well.
And then what sort of foods would you recommend people eat, Professor?
I was just about to say, not diet like literally. I mean, a certain protocol that you have to follow. So I was just making similarities. There's no special diet, but I mean, healthy eating, fruit, vegetables is always good for anyone, makes your hair stronger.
And just the final one, if people were to decide that they want to have a hair transplant, what should they be looking out for in terms of the facilities that they may try to visit?
Yeah, that's a good question, Sakina, because there's all these hair transplant clinics popping up everywhere. So again, I've had many patients coming to me who've had hair transplants for the wrong reasons, for the wrong indications, and they've spent thousands of rands on hair transplant, and 3 months down the line, the hair falls away. So there are specific indications for doing hair transplant. You cannot do hair transplant for certain conditions, for example, like inflammatory conditions like lichen planus, CCCA, all these other conditions I've mentioned. Hair transplant works very well for patients who have female pattern hair loss or male pattern hair loss, which is, the impandla or the genetic hair loss. It also works very well for traction alopecia, but for other conditions, it does not work at all, and you have to be assessed properly. So please do not go and do a hair transplant without having a diagnosis, without seeing the correct doctor who knows how to do that and what indications are there. Otherwise, your money will go down the drain and it will become irreversible.
Professor Dlova, thanks so much for your time. Head of Dermatology Department at the University of KwaZulu Natal, explaining to us what alopecia is and also some ways in which the condition can be treated.